Saving lives through a phone call or text message. Missouri is in the top 10 states in the nation for its 988 call and text response.
Our Missouri Chief Capitol Bureau reporter Emily Manley explains how the state is responding to an uptick in calls. That's after the 988 Suicide and Crisis Lifeline went live a year ago. She's live from Harris Stowe tonight with the exclusive interviews. Emily.
Well, Jasmine, here at Harris Stowe State University today, local, federal, and state suicide prevention leaders met to discuss how Missouri's call volume has gone up nearly 70% since 988 went live last July. Today's focus during the event was also how there is a rapid rising increase of suicide among Black teenagers.
From 2010 to 2020, the suicide rate rose 43% among Blacks.
For more than 365 days, a three-digit number has been helping thousands of Missourians.
And I can tell you that we've answered over 51,000 calls and 6,200 texts and 8,100 chats.
Suicide is the 10th leading cause of death in Missouri, with more than 1,200 people who died by suicide last year.
Before you make that decision that you can't walk back from, please give us a chance. So please call, but please don't ignore this resource.
Thursday, a plea from suicide prevention leaders asking college students to call 988 when in need.
That when their house is on fire, there's experience a problem, an emergency, they call 911. We need to make sure people understand that mental health emergencies are real and that 988 can be there to help you.
Missouri has 7 different call centers with a 94% answer rate. But if you don't want to pick up the phone and call, you can text or chat.
Mental health crises, mental health needs affect everyone. There is not an identity, a demographic that is immune to experiencing mental health crisis, to experiencing emotional distress.
Even though 90% of the 988 calls are managed over the phone, sometimes a face-to-face conversation is necessary in hopes of decreasing arrest and hospitalizations. Former St. Louis firefighter and current U.S. Health and Human Service Regional Director Joseph Palm says this new hotline is also helping first responders.
What they've told me is that it's reduced the amount of calls we have to respond to because people can call that number.
Now, right now, over the past 2 years, the state has invested about $30 million into 988. Right now, if you pick up your phone and call that hotline, you are actually routed to a call center based on your area code, which means it might not be answered locally. At the national level, 988 is working to make sure that there's a plan in place that if you do call the 988 hotline, it is routed based on your location instead. Reporting live tonight from Missouri State Capitol Bureau in St. Louis, I'm Emily Manley, Fox 2 News.